entrepreneurship help to ease dependence upon the government for funding, can little startups in terms of business help to even make sure that the people access healthcare even in better steads? Not necessarily treatment for diseases, but information and other sorts of businesses as it has to do with the healthcare industry. Well, one foundation has been at the forefront of enhancing individual capacity to ensure that little people access funding and other resources to be able to start up businesses that can improve the lots of the people when it comes to healthcare. Today I'm talking to someone that is a benefactor from that foundation, and her company is doing a lot when it comes to how you out there and myself can benefit from any business as it has to do with the healthcare industry. Indeed, today we are talking about startup entrepreneurship in the Nigerian healthcare system. And I have with me here Dr. Sandra Onwuekwe. I hope I got that right. She is a medical practitioner and co-founder of Verge Nigeria. Sandra Onwuekwe, you're welcome to the program.
Thank you very much.
So to start off, I had talked about a foundation that's at the center of enhancing capacity. Now we are talking about the Tony Elumelu Foundation, and you are a benefactor of the 2016 set.
Yes.
I'm a benefactor of the 2015 set. Today we are not going to be talking about the foundation. This program is all about the people. Now tell us about your business and how viewers out there can benefit, especially as it has to do with improving the healthcare system in Nigeria.
Okay. Concerning my business and how it affects health, it's a two-way thing really, because my business is focused on recycling. So we take things that could be recycled, like plastics, like cans, aluminium cans, and then we recycle it. Why I say it's a two-way thing is because it's affecting the environment, and we know that the environment is one of those factors that affects health. For example, I have a lecturer when I was in medical school, and he would say something: we want to eradicate malaria, but then really, if we do not take care of the environment, how exactly are we going to achieve what we want to do?
Of course.
So through our business, we're already doing something related to health.
Cleaning up the environment.
Yes, we're cleaning up
making it a healthier place, isn't it?
Exactly.
Right.
And then the other part is that we are providing corporate social responsibility to health. It might sound like, what is a startup doing with corporate social responsibility?
Especially as it has to do with
exactly, and you're just starting up and building up your business. But something I've realized is that, and something I believe is that, we should question the rules. We should question the rules. Who makes these rules? Why should only corporate bodies do corporate social responsibility? Why can't small businesses do little inexpensive things that can really influence health? One of the problems in the health system is that patients there's this gap in communication between the doctors, the nurses, the health professionals, and the patients. And if we can bridge that communication gap, it will help. For example, a patient comes and I'm treating a patient for malaria. If I see that patient and I give the patient the drugs, you tell me what's wrong with you and I give you the drugs and I say go. And then you come, or I use the other scenario where you come to me, you tell me, and I tell you, oh, you have malaria. We're going to do this test. I'm going to give you this drug. Take it. Explain to the patient, give information, let the patient be involved in the management. You'd see that the patient will be happy. So we believe that information is also important, and we're doing inexpensive things. For example, we started this campaign, 20 Days on Hepatitis. What we're doing is really very inexpensive. We're not spending so much, but we're reaching out. The idea is that for 20 days, we're going to be campaigning on hepatitis. awareness, really, and then encouraging people to get tested for their hepatitis B status. And we're doing this on social media, and we're going to be going out to churches, to mosques, to schools, because we're going to speak. Speaking is inexpensive, right? You don't pay for your voice.
Well, people get paid for their voice.
Well, we're not going to be paid for our voice. We're not going to be. We're going to give the information out, because
so you're giving back.
Yeah, exactly. So what's the point of having the information and keeping it? I mean, that's practically absurd. You're supposed to share information, right? So that's what we're going to be doing. We're going to be going out to tell people about hepatitis. Imagine WHO saying that 95% of people that are chronic carriers of the hepatitis B virus are not aware. And we have people, 4,000 deaths every day from hepatitis, viral hepatitis.
Well, before we come back to hepatitis, thank God you mentioned that, because hepatitis is something we've not really extrayed on this program. So we are going to be laying emphasis on hepatitis. But startup entrepreneurship in the Nigerian healthcare industry, and all you've said so far has made a lot of sense. We do not, as a people, especially startups like you and myself, as have been empowered by the foundation, we do not have to wait for the government to do things before we come out to do, like Verge Nigeria, that is embarking on this 20-day campaign on hepatitis that can improve the lot of Nigerians out there, especially as it has to do with information. You were telling me a story of someone who did not know that he was hepatitis positive.
Okay. So that happened this morning when I was coming
to the NTA.
Yeah, exactly. And I mean, he's in faraway India, actually. He's not in Nigeria. So you can see we're reaching out to beyond Nigeria.
Of course.
And then he said that he didn't know about his hepatitis B status, that he was positive, until he was diagnosed of leukemia. I mean, it's pretty sad that he had to be diagnosed of leukemia before he knew
his hepatitis
status. So, but imagine if we had created awareness. Imagine if people knew. And I'm telling you, people will be eager if you tell them that, this is what will happen if you are positive. I mean, that would drive people to ensure they know that.
Of course.
Yeah. So imagine if he had.
Well, we're talking about reaching out to the people, and like as it's showing on the screen. One of your partners was reaching out to the people.
Yes.
So it's basically about the people, isn't it?
Yes.
And today we are talking about how Nigerians can access more, not just necessarily waiting on the government, but startup entrepreneurship, as it were, has a huge role to play in the Nigerian healthcare system, isn't it?
Yes.
So tell us about the campaign. Let's come back to hepatitis now. What about hepatitis?
One thing I would say is that think of HIV, and then you know how HIV is, how everybody's afraid of HIV.
Yes.
But hepatitis B is 100 times that of HIV. So imagine what you think of hepatitis B and then multiply it by 100.
Now, hepatitis B being one of the viral conditions,
causes of hepatitis
that people can get through either share of sharps, sexual transmission, isn't it? Or even through childbirth.
Exactly.
So we're talking about hepatitis B right now, isn't it?
Yes.
All right.
Yes.
Please go on with the campaign. What's the campaign all about?
Okay, so what we're going to be doing is that for 20 days, which already started on Instagram, Facebook, and Twitter.
Okay.
Yeah. So we're going to be making, or rather, we are making awareness on hepatitis, but we're going to focus on hepatitis B because it is endemic in Africa.
Okay.
I did a recording sometime this week, and they asked me, why is it endemic in Africa? I don't know if you know, because I don't know too. So, but for me, it's going to be a learning process for 20 days. I know I'm going to be discovering things and facts that I don't know, and I want Nigerians, I want Africans to be aware of this, and that's why we started with social media. About 30 million Africans are on social media and on the internet. So, if we have 30 million Africans on the internet, that means the potential market that we can meet or we can reach out to is actually 330. That's quite significant.
Huge.
Yes,
that's really
that's
big.
significant.
And I tap something you say, it's also a learning process.
Yes.
Now I'm aware that the Federal Ministry of Health is looking out for organizations, little companies that can gather information and submit back to them to say, okay, this is what we've gotten. The government alone cannot do this thing on behalf of the people, and it's a very good thing that Verge Nigeria is going to be gathering whatever information that has not been available from this campaign, and I hope that you are able to submit it back to one of the arms of the ministry so that vital action can be taken in terms of what you find out. I hope that during our break we'll be able to really see the statistics why hepatitis had to become very important. Now, still talking about startup entrepreneurship and the Nigerian healthcare system, you were saying small companies do not have to wait. Like, who says small companies can't even do corporate social responsibility? But what about funding? What about funding? Is it not an important part? We know that doctors have gone on strike even recently just because of funding. Okay. What about funding? How does funding affect your business, especially as it has to do with this kind of healthcare campaigns for the benefit of the masses out there?
Okay. I think when a business is centered on driving impact, you will find a way. For Verge, we're not an NGO. We're going to make money. I mean, who doesn't like money? I'm Igbo. We're going to make money, but while making money, we want to share that wealth we're getting. I mean, the Bureau for Statistics says that about 70 Nigerians are living in poverty. 70% of Nigerians are living in poverty. And
some people say poverty is the biggest disease, isn't it?
You understand? So why can't businesses come with the mindset of creating impact? So I'm making money and I'm going to share money. Jack Ma, I hope I got that, the founder of Alibaba, he says wealth for him is to be shared. I mean, that's inspiring. That's why you see multi-billionaires giving out their money to social causes. So if businesses, if startups can come up thinking that way, saying, you know what, we're going to make money, we're for profit, but out of the profit we're making, we're going to give back. And why is it important to give back? I mean, if you accumulate all the wealth in the world, where would you take it to? You won't take it anyway. Once you die, the people around you will collect it.
Accumulating all the wealth whilst people are out
exactly.
dying from disease
Exactly.
conditions,
so, I mean, if we make the world a better place, it helps me and you actually. So imagine if where the poverty rate is growing and growing and growing every day and people are not finding food to eat and you are getting rich and rich and rich and rich. Don't you think one day the poor people will stand up and say, you that are getting rich, we are going to deal with you, you are going to become our food? Don't you think so? And then it won't be safe for us anymore. I mean, rich people will not have to run for their lives. In fact, you'll be an endangered species because you are rich. Because another person is poor. So we as startups, we as businesses should bridge the gap between economic growth and the social growth. So while we're growing economically, which I want to see in Africa, I mean, that's why I am so in love with the foundation. Your idea will transform Africa. It's not just limiting it to Nigeria, to Africa and beyond, yeah? So if we're growing to become how do I put it now? To play with the world power, and then Africans are not also growing. So I mean, that's sad. I read somewhere that a successful citizen of a failed country is a failed global citizen. So I mean, if you are successful and your continent is in shambles, I mean, that's
for the emphasis of this program, it is a health show, and yes, we want economic growth, but we also want people to be well. Without healthy people, there'll be nobody to enjoy the economic growth whatsoever. And thank God that the foundation made healthcare one of their very basic concerns. You understand? Well, I hope that we're able to get the 1 minute footage that tells us why hepatitis had to be very important. Still talking about startup entrepreneurship and the healthcare industry in Nigeria. It's not easy to start up a business. And a lot of people will rather be more dependent somewhere where they just want to receive salaries. Now, more so in the healthcare industry. We know that when you talk about healthcare, a lot of people think only hospital. When you say I'm a healthcare entrepreneur, they're saying, are you opening a hospital or are you opening a patent chemist shop? Tell us from your perspective some more of healthcare entrepreneurship.
Healthcare, one thing I would say is that health is really, really broad. That's the beautiful thing about medicine. I think that's what keeps me in medicine, because different things influence health. Education influences health.
Of course.
The environment, like my business, influences health. Information influences health. IT solutions influences health. So health is not really strictly clinical medicine, and we need to broaden our mindset from that, because when you tell people, oh, you're a doctor and you're not doing things in clinical medicine, I mean, they say you're not doing anything. You're not doing anything. So if people begin to look for ways in which we can innovate health through the different factors that influences health, like education, like the environment, so if people begin to see health that way, that how can I innovate the factors that influences health? So health is the hub, and then the factors, and then
a lot of factors.
Yes.
Well, yes, viewers and friends out there, for those of you looking to start little businesses, you need to plan how to innovate, try to bring something new. It doesn't necessarily have to be opening a hospital or opening a patent chemist store. You can help in the delivery system. You can help in information services. Well, stay tuned. We'll come back to this topic, but let's take a short break for now. Welcome back. You're still tuned into Lifeline, reaching you from the Network Center, Lagos Network Center of the Nigerian Television Authority. And Dr. Sandra Onwuekwe has been talking about startup entrepreneurship in the Nigerian healthcare system. In fact, we've been having a chat about startup entrepreneurship because we are both startup entrepreneurs, and we are growing and trying to contribute our own quota in the Nigerian healthcare system until we become large conglomerates, God willing. And like I said earlier, one foundation is at the forefront, as it has to do with enhancing capacity of individuals to be able to pick up business ideas in different fields, but with emphasis to this program and emphasis to myself, healthcare, as well as Sandra. Well, you can send in your text messages and follow us, continue this conversation on Facebook and Twitter. The different links are directly reaching you on your screen. Now, Sandra, we're talking about how people should pick up the mantle and try and innovate when it comes to starting up their own little thing. as it has to do with the healthcare systems. It doesn't have to be all dependence on the government, isn't it?
Yeah.
As it were. Now, let's come back to the people. You know, when it comes to healthcare, the people are the most important. Whatever we do, the people are the most important. So, in what ways do you feel that startup healthcare entrepreneurs can affect the people positively?
Okay, so for example, I'll use examples that have been going on the platform of the foundation, where we have 1,000 entrepreneurs with their various business ideas. One thing coming to my mind is a woman that is starting a diaper business.
Okay.
So if she decides she's building a market for mothers and their babies, she can decide that, okay, the way I'll give my corporate social responsibility is to do something centered towards the health of babies, and maybe ensuring that their mothers get their babies immunized. Like, for example, hepatitis, you can actually immunize children. So there's a link. So she can say, my customers will get like an alert, maybe through emails or messages, and you know, those things are inexpensive. But you're doing something, you're getting a child to get a health service.
But this you can do in addition to making sure
money
are cheaper.
Of course, and do you know,
and then employing people.
Exactly, and the moms will be happy because you're concerned about their babies. They are buying their diapers from you, and you also want to see how those children are growing. You're following them up as they're making their little steps, as they're smiling. Social smile comes at 6 weeks, and then you have immunization at 6 weeks. So you know, so it's just about innovation. Be creative. Let your mind go ballistic. And
immunization from birth. Actually,
exactly. Yeah.
All through the night, so.
Yeah. Exactly. So that can be our corporate social responsibility, and she's giving back in a very inexpensive way. And then as she grows, she can continue doing more and more as her capacity can carry. Another person has a business that it's into getting. Okay, patients have this thing. There are some times you would come for your clinic and you want to see a specialist, but because the specialist maybe had some engagement, and because of that he's unavoidably absent, so he's not present for the clinic, and the patient doesn't know. The patient comes knowing that, oh, this is my appointment day. So as he comes, and then you come, and then maybe, like for example, in the hospital where I work, patients come from Lagos to the hospital. So imagine a patient coming from Lagos to the hospital in Ogun State, and then there is no doctor. You don't need the doctor. The traffic, the 2 hours journey. But this entrepreneur is bringing in the idea that what if we create a system, an online system, where we
people
log
can
in.
Get their bookings.
Yes, they book, and then if you're not going to be available, the doctor can cancel, and your patient will know, oh, this doctor isn't going to be around, and then there's no way. I mean, that's innovation. It's like booking a flight and canceling a flight, but it has brought that innovation into healthcare.
Well, Sandra Onwuekwe, Dr. Sandra Onwuekwe, I'm afraid the time is fast spent for this episode of the program, but thank you for coming on. Such a short invitation. You were invited by the Tony Elumelu Foundation, and you came from far off to come and honor the invitation. Thank you for what your company is doing. I only pray that things will grow from where they started. Viewers and friends out there, we've been talking about startup entrepreneurship in the Nigerian healthcare system. Is there hope for the Nigerian healthcare system? Yes, there is hope. People are not waiting for only the government to do what they need to do. Other people are springing up to be able to contribute their own quota. And if you're someone who's been wishing that things get better in the Nigerian healthcare system, then you can say, thank God, alas, we are going somewhere. This is all we can take on this episode of the program. Until we reach the same time next week, ensure to have a blessed time out there.
Business Network Center.
Wannan shine abin da ya faru da ɗana ɗaya Raksani. Na yi matuƙar da na sanin fatattakar jami'an rigakafin polio da na riƙa yi a baya.
Kamar yadda mai gidana ya faɗa, mun ɗauka muna kare ɗanmu ne a lokacin da muka hana mashi rigakafi. Ashe ba mu san muna saka shi cikin hatsarin kamuwa da polio ba ne. A yanzu dai likita ya ce ba zai ƙara tafiya da kafafunsa ba har abada.
Na ji kun ce an yi wa wannan yarinya rigakafin bayan haihuwa ko? To wannan kaɗai bai isa ba. Ku tabbatar ta karɓi dukkanin rigakafin da ya dace kuma akan tsari. Ku ɗauki darasi mana daga abin da ya faru da mu.
Cututtuka kamar polio.
This is the network service of the NTA.
Hello, good evening and welcome. After holding a formidable and strategic stake